When a woman finds a lump in her breast, or if she's called with the report on the mammogram that's abnormal, all her red lights go off. She often is convinced she's got cancer just with that information. Everybody knows someone diagnosed with breast cancer, and it's not unusual to know that someone's died of breast cancer. So those patients call our office very anxious. The girls at the front desk know that, and they make every effort to get that patient in as quickly as they can. We sometimes can see them on that very same day. We have an ultrasound machine in the office that I started using 20 years ago, before it was really commonly used, and it's become the mainstay of management of breast problems. When the patient comes, we in many cases are able to do the biopsy that same day. And we know the patient's worried it's going to hurt a lot, but we've got some unique things to make it almost never be a painful experience. We go out of our way to get that information to the patient as quickly as we can on the diagnosis. It's not uncommon for us, for those patients who are unlucky enough to have a cancer, we often can tell that just from the findings on the ultrasound and the physical exam. If that's the case, we kind of work them through that diagnosis and what the treatment will be. We go out of our way to try and schedule the surgery, if that's the first thing to do, as quickly as possible. Our surgical coordinators are very attuned to the importance of getting that done as quickly as possible, and they are really wonderful with the patients. My main job as the surgeon is to get the cancer out and get it out with clear margins. Margins are kind of like if you have a hard-boiled egg and the egg yolk is the cancer and the white is the normal breast tissue. Rather than go and just get the egg yolk out, you want to carve out some egg white all around the egg yolk. Now, cancer isn't color-coded, so we can't always tell that the margins are clear at the first operation. And for that reason, a lot of women, surprisingly, must go back for a second operation. That need to return to the operating room always frustrated me in the past. And I actually devised a surgical instrument to try and help me to decrease the likelihood of having to go back to the operating room. And through the years with my experience with this instrument, we've cut that rate down from about a quarter of women down to only about 1 out of 10 or 12 women needing to go back to the operating room. When women are diagnosed with breast cancer, they often ask, why did this happen? Or what can I do to prevent something else from happening? And we do focus on lifestyle changes, nutritional or dietary interventions. And of course, since the patient is part of the team, there are things that they need to do too. So we focus on those things. In fact, we have a lot of information on our website about those sorts of things, and a lot on there about the diagnosis and the treatment, and it's individualized as much as possible. For instance, if you already know what stage of cancer you have, you will find information that's individualized to that particular treatment plan on the website that you can review, and it'll help you to be educated even before you come to the office for our discussion.